Hello, my name is James, and I'm the student physical therapist today. And today we will be doing a range of motion and muscle tests. Do I have consent to conduct these examinations?
Yes.
Thank you. Okay, so we're gonna go into hip flexion muscle test. So I'm gonna stabilize right here by the muscles of your hip, and I want you to just flex. Well, good job. You already did that, but go ahead and flex your um, hip up. Perfect. And now I'm going to add resistance. Fight against the resistance in my hand. Good. Patient showed 5 out of 5 grade because she was able to hold her leg against the resistance. Okay, now we will be conducting the external rotation. So I'll be stabilizing right here. And then I want you to externally rotate. So that means just lift your leg to your midline, right there. Good. Okay. The second time I have you do it, I'm gonna add resistance right here, and you're gonna fight against my hand. Okay? You see that? All right. Go ahead. Good. The patient showed 5 out of 5 grade. She was able to hold the position against the resistance. Now we will be performing an internal rotation manual muscle test. And so I will be stabilizing right here at the pelvis, and let me get on the leg, and then so boom, I'm gonna protect this inner knee joint, and you're just gonna move away from the midline. Good. Okay, so now let me see you move away from the midline again. Okay. Now I'm gonna have you do it one more time, and I'm gonna add resistance right here, and you're gonna fight against that resistance. Ready? Good. Patient shows 5 out of 5 grade. She was able to do the range of motion by themselves, and again, fight against the resistance and be able to hold against the resistance. Okay, now we will be doing a manual muscle test on hip extension. I am going to stabilize at the gluteal muscle and have the patient extend their hip. I'm gonna stand on the side of the leg where we're doing the manual muscle test. So, boom, stabilize, and can you complete the range of motion? Good. Okay. The next time, I'm gonna add some resistance right here, and I want you to keep your leg up and don't let me resist you. Ready? Good. The patient shows a 5 out of 5 grade, able to do the range of motion by themselves and be able to hold their leg up against their flex their hip against their resistance. Okay, now we will be doing a hip abduction manual muscle test, and then we'll be grading the patient on a 3 to 5 scale. Let's go ahead and have the patient, well, they're already laying on their side. So we're gonna have the opposite leg just move slightly forward, boom, and then I'm gonna just have you straighten out this leg just for now. Okay, so now I'm gonna stabilize at the pelvis right here, about so I found the iliac crest, and then I'm gonna stabilize at the glute med, right? And then I'm gonna have you right over here. I'm gonna have you abduct. So you're just gonna move your leg away from the midline of your body. Boom. Good. And then jump it. And then now I'm gonna add resistance, and I want you to be able to fight against that resistance, and we'll be able to grade your muscle test. Okay. So here, go ahead and abduct. And go ahead and fight. I'm gonna have this resistance. Good. Okay. So the patient we'll be having a grade. Now we'll be performing the adduction manual muscle test. So I'm gonna actually have you bring this leg up forward and this leg back. And I'm gonna actually hold this leg up so we can perform the adduction, right? So I want you to go ahead and bring this leg towards the midline of your body. Okay. And while the patient is abducting, I'm stabilizing right here at the hip, the pelvis, okay? So now I'm gonna add resistance and I want you to hold against my maximum resistance, okay? Ready? Go ahead. Good. Patient was able to hold against maximum resistance and perform the range of adduction by themselves. So they will be a grade 5 out of 5. Okay, now we'll be performing a hip flexion range of motion test. And I'm gonna have the patient first lay supine, and then we're gonna use the right hip to do the flexion. So I will stabilize at the pelvis right here, and the motion will be a flexion of the hip going towards knee to the chest. Okay. And then go ahead and bring your knee back down. Okay, now I'll go ahead and do that passively to the chest. Good. And there, I believe that was a firm infill. And the degrees for that is normally 110 to 120. Okay, now we will continue, and for the hip flexion, goniometer landmarks, the stationary arm will be like the midline of the pelvis, so I would say the PSIS, and then the axis of rotation would be the greater trochanter, and the movement arm would be the midline of the lateral femur to the lateral epicondyle. And the goniometer landmarks for the hip flexion will be, the stationary arm will be the midline of the pelvis. So I would say the ASIS, and then I would go for the axis of rotation is the greater trochanter, and the movement of the arm is the midline of lateral femur to the lateral epicondyle of the knee. Okay, now we'll be performing hip abduction range of motion test. And so I have the patient lying supine, and I'm going to have the patient perform abduction. So I'm just going to go ahead and first I will palpate at the iliac crest. Boom. And then we're just going to go ahead and move your leg away from the midline. Okay, so you see the patient's range of motion. And then now I'm going to do it passively. You can see that there is a little increase in the range after the passive range of motion. And then so we're going to go ahead, and the infill that I came up for that is firm, and the degrees that you're looking for is 40 degrees or 40. Okay, now we will be performing the adduction range of motion test. And so now I will have the patient supine, and first we're gonna need an ample amount of room to abduct the leg. So I'm gonna go ahead and move this. And then now we will be abducting this leg right here. And so let me first go ahead and stabilize at the iliac crest, alongside the iliac crest. And then I'm gonna go ahead and have you move your leg towards the midline for abduction. Good. Okay, you can go ahead and bring it back. Okay, now I'm gonna do passive range of motion. So I will be abducting. Good. And the infield is firm. After performing the adduction, we have the goniometer landmarks for as the stationary arm, a line between both anterior superior iliac spines, and the axis of rotation is anterior superior iliac spine, and the movement arm is the midline of anterior. Okay, now we will be performing hip internal rotation range of motion test seated, as you can see. So we're gonna go ahead and I will be stabilizing at the distal femur. So we're gonna go ahead and do, go ahead and do this leg right here. Got it. And so for internal rotation, you're just gonna basically just act like you're bringing your hip to the midline. So, like that. Perfect. Okay? And we're just gonna, I'm gonna be, stabilizing your leg as you go ahead and perform this rotation right at the femur as well. So, go ahead and just perform the range of motion. Boom. Good. Okay. Now I'm gonna passively rotate the patient's leg. Good. I would go ahead and say that's an infill, firm infill. Okay, now we'll be performing hip external rotation, range of motion, seated. Okay, so now I'll go over here and get to the side of the patient's leg. They'll just be short sitting right here. I'm gonna go ahead and stabilize at the distal femur test side, right? And so for the external, I'm just gonna have you, right? Just move your leg right here, what I'm holding. And the range of motion is just try to, right there, okay? And so I'm gonna have you do it by yourself, and then I'm gonna perform passive, okay? And that would just be me assisting you with the range of motion. Okay, we'll begin right now. So go ahead and, yep, good, okay. Now I'll passively go ahead and perform the range of motion. So, good, okay. And so the infield is firm, and the stationary arm is perpendicular to the floor, and the axis of rotation is right here at the knee, and the movement arm would just be the leg, which was moving, right? All right.